Did you know that a single antibiotic pill can stay in your body for days, fighting bacteria even after you stop taking it? Azithromycin, commonly called a Z-Pak, is one of the most prescribed antibiotics. But how does it actually work inside your body? Let's dive into the science behind it. What is azithromycin, Z-Pak? Azithromycin is a macrolide antibiotic, meaning it works by targeting the 50S ribosomal subunit in bacterial cells. Ribosomes are like tiny protein factories inside bacteria. By binding to the 50S subunit, azithromycin blocks mRNA translation, preventing the bacteria from making essential proteins. Without these proteins, bacteria can't grow, divide, or survive. This is why azithromycin is classified as a bacteriostatic antibiotic. It doesn't directly kill bacteria like bactericidal antibiotics do. Instead, it stops them from multiplying, allowing your immune system to clear the infection. Unlike some antibiotics that must be taken multiple times a day, azithromycin has a long half-life of around 68 hours, meaning it stays in the body longer and requires fewer doses. What infections does azithromycin treat? Azithromycin is a broad-spectrum antibiotic, meaning it is effective against a wide range of bacteria. It is commonly used to treat bacterial infections, especially those affecting the respiratory tract, skin, and soft tissues. Here are some common conditions it treats: respiratory infections, pneumonia, bronchitis, sinusitis; streptococcal infections, strep throat, ear infections; skin infections, impetigo, cellulitis; sexually transmitted infections, STIs, chlamydia; gastrointestinal infections, traveler's diarrhea in some cases. Since it targets both gram-positive and some gram-negative bacteria, azithromycin is often chosen for infections where the exact bacteria haven't been identified yet. How does the Z-Pak work? Azithromycin binds to the 50S ribosomal subunit of bacterial cells. This blocks mRNA translation, preventing the bacteria from producing essential proteins. Without proteins, the bacteria can't grow or replicate, allowing the immune system to clear the infection. Because of its ability to accumulate inside phagocytes, the immune cells that fight infections, azithromycin is especially useful for treating infections in the lungs and soft tissues. How to take azithromycin. Azithromycin is usually taken as a short 5-day course called a Z-Pak. Day 1, take 500 milligrams, 2 tablets. Days 2 to 5, take 250 milligrams, 1 tablet per day. It can be taken with or without food, but if you have stomach upset, take it with a light meal. Side effects and precautions. Like all antibiotics, azithromycin has some side effects. Here's what you might experience. Common side effects: nausea, diarrhea, abdominal pain, rare but serious side effects, QT prolongation, heart rhythm problem, liver toxicity, especially in patients with liver disease, severe allergic reactions, rare. QT prolongation is a condition that affects the heart's electrical system, making the heartbeat irregular. This is why people with heart conditions should use azithromycin with caution. Warnings and antibiotic resistance. Do not take azithromycin with antacids containing aluminum or magnesium, as they can reduce its absorption. Only take antibiotics when prescribed. Misuse can lead to antibiotic-resistant bacteria, making future infections harder to treat. Azithromycin is a powerful and widely used antibiotic when taken correctly. Always follow your doctor's instructions and don't take antibiotics unless you really need them.